Assalamualaikum warahmatullahi wabarakatuh. Good day, everyone. I am here with my friends. Will be present the debating final project, British Parliamentary Debate. The topic we are choosing is when resources are limited, THS hospital that prioritize treatment of patients who are vaccinated against COVID-19 to patients are not. Before we begin, let me introduce my team. I am Dima Wirdati Aswan as the Prime Minister, and Wong Mei Fang as the Deputy Prime Minister, Gilang as the Member of Government, and the last speaker attended by Anna as the Government Whip. For the opposite team, Hikmah, time is yours.
Thank you, Dima, for the change. Well, I'm Hikmah as leader of opposition, which is we were on different boat with the first speaker. And the next one, Romel as deputy leader of opposition, and Evelyn, member our part of opposite, and Ninda, the whip of opposite. Thank you.
Okay, and without ado, let's begin. Vaccines are a key intervention to reduce the burden of a COVID-19 pandemic. However, vaccine supply and administration capacity will initially be limited. Due to these constraints, it is critical to understand how vaccine deployment can be targeted to minimize the overall burden of disease. The THS hospital requires doctors to treat all patients equally. But what happens when you run out of doctors? This is not the first time medical staff and hospital beds were in short supply during the pandemic. There is, however, something notably different this time. In the early stages of COVID-19, patients overflowed hospitals at alarming rates. This forced physicians to make tough decisions, some likening it to conducting triage during war. Patients with the best chance of survival got the bed, the rest did not. It was the death sentence few healthcare providers wanted to write, but that the virus necessitated. A year and a half later, it's happening again. Hospitals are overflowing and medical staff are in short supply. Unlike the pandemic started, this is not necessary. There are now several remarkably safe and effective vaccines that could all but eliminate hospitalization and deaths. Regrettably, many people are simply refusing to use them. When there was no vaccine, medical triage was straightforward. But now the situation is changing. It's not a level playing field. Many of sick needing care have turned down a vaccine that could have prevented them from needing hospital care. This raises an uncomfortable ethical question. Should eligible unvaccinated people be medically triaged at the same priority level as the vaccinated? If medical capacities weren't being reached, it would be simple. In medicine, everyone receives equal access to treatment regardless of personal choices, but it's not as simple anymore. This hypothetical situation is already happening in real life. In Arkansas, only 37.6% of population is fully vaccinated. Due to the influx of patients infected by the Delta variant, there are now only 8 intensive care unit beds available statewide. This means that anyone in need of urgent critical care have urgently nowhere to go in this region without expensive and medically risky out-of-state transfers. Meanwhile, an eligible unvaccinated person is receiving ICU care. Is it right? Is it fair? What if 2 people enter a hospital at once? One was eligible for the vaccine but denied it and now needs treatment for severe COVID. And at the same time, another vaccinated individual is in heart failure. If there's one bed left, who gets it? What's fair? It's not only adults. The Delta variant is now infecting children at significantly higher rates. According to projections by the state's health department, the children's hospital in Tennessee will be filled by the end of this week. Other children's hospitals are also seeing rapid increases as schools reopen. 1,000 of children have already tested positive and been quarantined. However, today's reality is that hospitals are nearing capacities due to people refusing to get vaccinated, and we must decide what is fair now. In summary, I'm going to come right now and say that in situations where hospitals are overwhelmed and resources such as intensive care beds or ventilators are scarce, vaccinated patients should be given priority over those who have refused vaccination without a legitimate medical or religious reason. Thank you.
Okay, thank you, Ms. Dima. I'm Hikmah as leader of the opposition, and this is my statement against yours. Well, the script for your statement, Ms. Dima, but hereby I find some rules that are potentially made by the health government's unconsciousness. Like, here is my question that definitely I want to ask. Did the rules just make by conditionally improvisation, let's just say COVID-19, and did government forget about how important health services for citizens as their basic standards right? We know that the legal basis for health insurance is stated in the 1945 Constitution, Article 28, and stated that first, everyone has the right to live in physical and spiritual prosperity, like to have a place to live, to have a good and healthy living environment, and have the right to obtain health services. Like once again, emphasizes the last statement, have the right to obtain health services. Like second, everyone is entitled to special facilities and treatment to obtain the same opportunities and benefits in order to achieve equality and justice. And third, every person has the right to social security that allows his full development as a useful human being. Don't forget, furthermore, the legal basis for the existence of health insurance is also contained in Article 34 of the 1945 Constitution, which stated first, the poor and neglected children are cared for by the state. Second, the state develops a social security systems for all people and empowers the weak and underprivileged in accordance with human dignity. And the last one, the state is responsible for providing proper health care facilities and public service facilities. Like as we know, legally and constitutionally, the issuance of law number 40/2004 concerning the national social security system, one of which is the GKN facility, the implementation of which is organized by the Social Security Administering Body, or BPJS we know, for health. The issuance of Law Number 40 of 2004 concerning the national social security system mandates that every person or citizen has the right to social security to be able to fulfill the basic needs of a decent life and increase his dignity towards the realization of a prosperous Indonesian society. The Social Security program, according to the law, includes health insurance, work accident insurance, old age insurance, pension insurance, and death insurance. And we have seen so much news broadcasted that vaccine distribution across this country, is still unable to implement on an average quantity and quality basis. How could citizens that don't know anything about government regulations, how those are all made and works affected their basic human needs, which is to get the proper health services? Remember that we are human and yet we all have empathy, right? Here we talk about human rights and human lives. Thank you. That's all from me.
Okay, thank you for your statement, Hikmah. But I agree and support Dima's statement that hospitals or doctors prioritize patients who have been vaccinated over patients who have not, because until now, the coronavirus pandemic has not ended yet. In order to suppress the increasing number of cases, the COVID-19 vaccine has been implemented by our government since last year. The government takes the responsibility for the nation's health, insisting that every good citizen should take vaccine. As a good citizen, why should we get vaccinated against COVID-19? As a part of a society, we do have responsibility to take care of one another by taking the vaccine. People who refuse to take the vaccine are considered as the irresponsible citizen. They are considered to threaten the well-being of whole nation. Besides, doctors are also human. They have family to take care. We cannot blame them if they prioritize the vaccinated patients. By taking precaution, they want to make sure that they are not the ones who transfer the virus from one to the others. This vaccine is a good temporary solution which is considered the most appropriate way to reduce the number of cases of this virus infection. Even since the COVID-19 vaccine has been implemented, there are still some sort of people who do not agree upon the government's recommendation to undergo COVID-19. In fact, the provision of the vaccine is very important, not only to protect the community from COVID-19, but also to restore the social and economic conditions of countries affected by the pandemic. Vaccination or immunization aims is to enhance the immune system so that the body is able to recognize and to fight bacteria or viruses which cause infection. The goal of giving the COVID-19 vaccine is to reduce morbidity and mortality due to this virus. Although not 100% able to protect a person from coronavirus infection, this vaccine can reduce the possibility of severe symptoms and complications due to COVID-19. In addition, the COVID-19 vaccination aims to encourage the formation of herd immunity. This is important because there are some people who cannot be vaccinated for certain reasons, and this is the responsibility and awareness of every citizen or people who wants to be vaccinated against the people around him. I agree upon if I were a doctor, I would also prioritize the vaccinated patient. Thank you.
Okay, thank you, Ms. Mei Fang, for your statement, but I support and agree with my statement because the patients who have been vaccinated or those who have not been vaccinated should receive the same treatment. If hospital and healthcare resorts were not severely strained, if there were no areas where vaccination rates are dangerously low and the Delta variant is spreading fast, there will be no problem. The vaccine refusal, although morally blameworthy, would still deserve the best care possible. Say one person arrived at an emergency room suffering a massive heart attack. The other, defiantly unvaccinated, has come down with COVID-19 and is struggling to breathe. ICU beds are scarce at this hospital. So are ventilators the foreseeable result of the decision by this COVID patient and scores of others like him not to live up to their responsibility to be vaccinated? It is not only ethical to discriminate against it, it would be morally wrong not to give priority care. No one is going to yank a ventilator from an unvaccinated patient to treat a vaccinated one in desperate need one of treatment, and that is not what I'm endorsing. In the real world, these decisions are going to be made in split-second assessment upon arrival. My argument is that doctors are not acting unethically by putting a finger on the scale in favor of the vaccinated. They are behaving rationally and justly. Emergency physician and Dan Hamflin has written extensively about how to track care, and he agreed. If you believe there is a certain degree of accountability that was a citizen have to take for each other to protect our community, then that group of individuals who have willingly chosen not to vaccinate it for a legitimate reason, it would be fair to place them at the back on the line of the line. Not kick them out of the line, just move them back, he told me. At the end of the day, if you have willingly chosen not to do something that benefits the public good in the setting of a national crisis, then there are certain consequences. Thank you.
Okay, nice opinion, Romel, but I don't agree with your opinion because in station, the hospital are overwhelmed and rescue such as intensive care beds or ventilator are scarce. Vaccinated patients should be given priority over those who have refused vaccination without a legitimate medical. This conflict radically with accepted medical advice. I recognize, and under ordinary circumstances, I agree with this rule. The lung cancer patient who has been smoking two packs a day for decades is entitled to the same treatment as the one who never took a puff. Doctors are healers, not judges. But the coronavirus pandemic, the development of a highly effective vaccine, and the emergence of a cloud of vaccine resistance, along with an unexpected new variant, have combined to change the ethical calculus. Those who insist on refusing the vaccine for no reason are not in the same moral position of the smoker with lung cancer. In situations where rescue are scarce and hard choice must be made, they are not entitled to the same must be made. They are not questioned, nor asked, nor holds barred medical care as others who have behave more responsible. Vaccine resistors are different. Their refusal to take the shot doesn't just affect their own health, it poses a known risk to the health of others, especially now when the spread of the Delta variant. To take plan to be vaccinated is fail to live up to your duty to your community, and it should mean that you provide, if necessary, your claim to equal medical treatment. If hospital and healthcare rescue were not massively strained, when there were not areas where vaccinated rates are dangerously low and the Delta variant is spreading fast, there would be no problem. The vaccine refuser, although morally blameworthy, will still deserve the best care possible. But there is not care case to into many parts of this country. Say one person arrived at an emergency room suffering a massive heart attack. The other, defiantly unvaccinated, has come down with COVID-19 and is struggling to breathe. ICU beds are scarce at this hospital, so a ventilator the possible result of the decision by the COVID patient and score of others like him, not to lock up the responsibility to be vaccinated. It is not only ethical to discriminate against him, it would be morally wrong not to give priority. In the real world, these decisions are going to be made in split second assessment upon arrival. Okay, thank you.
Okay, I'm so appreciate the member of oversight statement, and thank you for giving me the opportunity to put forward my statement. So, the member of government, Gilang Syadat Pratama, he mentioned about their responsibility to be vaccinated. What? Who do you mean they are in here? Do you mean civilian? But remember that it is the government responsibility to ensure the health of the entire community without exception, right? In Indonesia itself, there is a law that guarantees equality as stated in Pancasila. It is Sila number 5, social justice for all of the Indonesia people. Isn't it very unfair? In any situation, there are exceptions in health institution. The government certainly cannot provide exception for those who refuse to be vaccinated. It could happen because of the lack of effort from the government to educate the public about vaccination. After all, not all areas in Indonesia can be reached easily. What we gonna say about the tribes in remote areas? Has the government reached out to the remote areas? Of course, it is not that easy to get them to be vaccinated. Maybe they could refuse because even before this pandemic, the government could not guarantee the development in the area. So how can they be sure of anything organized by government? And that refers to the one of the uh, leader of opposition, Hikmatul Mahama. She's quoting 1945 Constitution, Article 20H. That's about everyone has the right to live in physical and spiritual prosperity, to have a place to live, to have a good and healthy living environment, and have the right to obtain health service. It's clear enough? Of course, being vaccinated or not has confirmed that health insurance is a right for all Indonesians, not just citizens who have been vaccinated. So that's all my statement. We can go to the next speaker. Thank you.
Okay, thank you, Evelyn, for statement. But I disagree. Why? Because the number of health workers alone currently reaches approximately 600 health workers. With the protection provided through vaccination program for health workers starting from January until March 2021, health workers are not exposed to too many COVID-19. Almost 100% of the health workers, totaling around 6,000 people, have received the first and second doses of vaccination. Of this number, only 308 health workers were exposed at around 13% of the total number of health workers, and most of them have recovered and have started working again. Side by day. To anticipate and carry out health intervention, the Ministry of Health has allotted 50,000 special doses of COVID-19 vaccine to accelerate vaccination coverage. This is an effort to protect the public from COVID-19 because it is proven that vaccination provides protection for health workers who have received it first. We need to inform people that people should not ignore health protocols even though they have been vaccinated. Vaccination itself is actually only a means of increasing immunity so that if exposed to COVID-19, there are no severe symptoms. Okay, thank you. Next.
Okay. From statement Anna, I'm disagree. Illness is designed to make it easier for people to access health service, can provide protection against the safety or patient communities, hospital environment, and research at the hospital and can improve, maintain hospital service standards, and providing legal certainty to patient, communities, hospital, and hospital. Research section 29 and section 58, the year 2009, bill number section 26 specifies that the health staff is suspected of negligence in its profession. Such negligence must be met first through meditation. Chapter 58 regulates regarding the right of each person to demand restitution to a person, health personnel, and or health administrator that inflict harm on him or her disability or negligence in his or her health care. The term shows that the prosecution makes up the damage either as a result of errors, deliberate or negligence in healthcare, and the prosecution is direct to either to person, the health worker, or the hospital. The coalition, according to the number 44 year 2009 law, the prosecution was directed only to the hospital which was due specifically for ill health care at home. Thank you.
All right. I think that is enough for today debate session. Thank you all for your opinion and willingness to give such an idea for this debate. For those who watching, I hope you guys enjoy and took a lesson by it. And I hope I am, as the representative of my friends, would like to say sorry if there was many mistakes during the debate. That's all. Wassalamualaikum warahmatullahi wabarakatuh.